Hi, I'm Dr. Patrick Foy, and I'm a medical doctor specializing in pain management and physical medicine and rehabilitation. And my website is www.tailbonedoctor.com. In this video, we're going to talk about how to describe tailbone pain, or coccyx pain. I treat hundreds of patients per year for coccyx pain, and many of them tell me that when they have seen their previous physicians, they really weren't sure how to describe the pain in a way that helped the physician to really understand what they were suffering with or going through. So the point of this video is to give you a couple of ways to think about your pain so that when you do see your physician, you're able to describe the pain in such a way that hopefully they'll be able to figure out what's causing it and, more importantly, help to treat it. First of all, of course, is locating where is the pain coming from. If you can tell the location of your pain, for tailbone pain, it usually is coming from the very lowest part of the spine. The lower back is up through here, and this area is the sacrum, and the lowest end of the spine is the tailbone, or coccyx. It's located just in between the buttocks, right in the midline. Also important is to describe how severe is your pain. On a 0 to 10 scale, for example, is it very low pain, like a 1 or a 2, or is it more severe, like a 9 or a 10? Also important is the duration. How long has the pain been going on? That ties in closely to the onset. When did the pain start, and what was going on at the time? Did it come on all of a sudden, or did it come on more slowly? And if it came on all of a sudden, was it associated with some trauma or impact to the area that may have caused a fracture or dislocation or something along those lines? Also, be sure to use your own words to describe the pain. Is it dull, aching pain, or is it more sharp or stabbing? Also, pay attention to what makes the pain worse and what makes it better. Often patients will note that with tailbone pain, it's often worse when they're sitting down. And when they're sitting, they're putting weight on the tailbone, and that presses on it. Often it's also worse for some patients when they first get up from the sitting position. Things that make it better might be standing and walking, or pain medications, or certain types of local injections that can be done by a physician. Hopefully these tips were helpful for you in describing tailbone pain so that your doctor will be able to understand what's causing it and, again, to give you some treatment that will help you. Thank you. Okay, just a couple of quick warnings and disclaimers about this video. Please realize that this video is meant for educational purposes. It's not meant to be specific medical advice for any individual. For that, you really would need to see a physician and be evaluated in person by a doctor experienced in treating tailbone pain. Also realize that tailbone pain sometimes can have some very serious causes. Things like cancer, malignancy, tumors, infection. So again, you owe it to yourself to have an in-person evaluation by a physician with experience in this area. Also, realize that tailbone pain is relatively uncommon compared to most other types of low back pain. So many doctors may be unfamiliar with how to properly and thoroughly evaluate tailbone pain, or they may be unfamiliar with some of the current treatments that are available. So you really may want to consider, if you're not getting the answers and the relief that you want, you may want to consider seeing a specialist who has particular expertise in the treatment of tailbone pain. For more information, please feel free to check out the website www.tailbonedoctor.com. Thank you.